Okay, hi and welcome. I'm Laura Palmer. I'm a certified massage therapist with Sutter Health. I see patients at our IHH Santa Rosa clinic, and I really felt inspired to share my experience about connection, presence, and the need for self-care for pregnant women. So some of you listening today are healthcare professionals that help pregnant women, and some of you might even be pregnant yourselves. So today I hope to share the power of massage and other modalities like yoga and nutrition and self-care techniques for pregnant women. Now, of course, women naturally understand the importance of regularly seeing their primary care provider or their obstetrician, gynecologist, and kind of following the recommendations. For example, like taking prenatal vitamins. But they often don't recognize the myriad of resources and tools available to them at Sutter Health. Our organization offers really many trained professionals in our integrative program for Sutter Institute for Health and Healing to support all the hard work of all our dedicated providers caring for prenatal patients. Through massage and other supportive modalities, we can really elevate our perception of pregnancy by supporting women's bodies and helping them create positive associations with touch and support. Always I recommend and encourage women to speak with and work with their physicians for safety, including their, individual needs. But I truly feel integrative healthcare is a good complement to that care, and it's also really a great pathway to health and wellness and an avenue for developing self-care techniques for prenatal women. However, I thought it would be really important today not only just to talk about how integrative practitioners can help and emphasize the importance of their physician's advice, but also take the time today to really discover how women themselves can be empowered to use self-care tools and resources to kind of achieve that goal of maintaining health and wellness during pregnancy. Really, you guys, one of my greatest joys as a certified massage therapist is working with the prenatal and postpartum patients. As much joy as pregnancy brings, it can also bring a lot of changes, and with that comes some discomfort. Recently, I've noticed, too, an increase in our community this year. I live in Sonoma County, and I work in Santa Rosa, so fires as well as the pandemic, there's certainly more stress and anxiety. And although pregnancy is kind of this normal physiological life event, these changing times, I think, really mean that normal stressors of pregnancy and physical changes that accompany, creating and growing a new life are really different. I think, honestly, self-care is no longer how it's been looked at before, like a luxury. I think it should really be viewed as a necessity. Because today, to me, it only makes sense to take the time to just kind of work with our patients and reach out and give some inspiring suggestions for self-care at this time. I think it's really empowering. And we as healthcare professionals, we have this amazing opportunity to encourage our clients, maybe even our family members and coworkers who are pregnant, to take care of themselves during, each stage of their pregnancy. And if you're pregnant as a staff member, I know you've been working so hard with all these changing times. And this is such a chance for renewal and nurturing, as well as, an opportunity to focus on the physical discomforts. Perhaps you're a pregnant woman listening on our social media platform. The main thing to know is over the 40 weeks or 9 lunar months divided into 3 trimesters of pregnancy, all throughout this time, your body is changing, growing, blossoming, and it's going to undergo some massive transformations. And during that time, there's so many ways to care for yourself during the pregnancy. The typical advice, like eating healthy, nutritious diets, exercises like walking and yoga, prenatal massage, I think they can all make pregnancy so much more pleasant. And, really self-care is kind of just what it sounds like, checking in with yourself, and sometimes even on a moment-to-moment basis to really understand what you need. Because self-care allows for all those meaningful practices, routines, actions, kind of finding ways to combat stress, anxiety, physical discomfort. ultimately, self-care is even more important when you're caring for and, helping develop another human being. In fact, pregnancy is the perfect time to care and nourish your body. Pregnancy is about trusting that transforming process, like life's rhythms, about connecting one's own deep wisdom and power. As a mom, I really think it's okay to be tender with yourself and ask for the help you need. Pay attention to your body. Listen to clues, both physical and emotional. I think really the goal of self-care from at least an integrative medicine approach is to nourish that mind, body, and spirit. Self-care is really taking care of yourself, not only your pregnancy, but your baby too. A part of great self-care regimen, I think, is to seek out professionals who really can help support you during your pregnancy. Pregnancy is like this incredible time in your life. It's full of joy, excitement, curiosity, love. But like I said, your body is working, and it's working overtime. And chances are you're experiencing a variety of kind of new aches and pains and concerns. A prenatal massage from a professional massage therapist, certified in pregnancy massage, basically technically trained, is therapeutically beneficial. A prenatal massage is, in some ways not different from a regular massage. Like the goal is to get relaxed, work out tension from muscles, reduce soreness, decrease comfort and pain. But however, rather than spending the entire session just lying down, you're going to have a few accommodations. Maybe you'll be on your side and in a semi-reclined position with all these kind of amazing pillows and bolsters, and that's really going to increase safety and comfort and stability. But there's still going to be a lot of accessibility, so we can still get your back and also mainly just create that safe, nurturing space. Special care is always taken to allow for physical changes that accompany pregnancy. And I can address some really specific symptoms that are unique to pregnancy. I mean, let's face it, there's like a lot going on. You're getting some enlarging breasts, some weight gain, muscle imbalance. There's fetal positioning, the way the baby is laying can affect how you feel. There's hormonal effects on your ligaments. There's sometimes what we call referred pain from the uterine ligaments. Like, you just name it, it's happening. And I think the most common complaint I see as a result of these changes is, you're going to guess it, back, pelvic, and hip pain. Almost always I can count on that like second and third trimester pregnancy, some kind of musculoskeletal pain. And I really think massage works by decreasing chronic muscle tension, and then often this helps not only to reduce discomfort, but it can also help to restore postural balance and decrease the discomfort from your changing body as your weight shifts. I really see this in like two ways generally when I'm seeing some patients. Anterior posture, where the weight of the uterus, where how the baby is lying, is either carried anterior, that means like to the front in the normal center of gravity, or sometimes it can be posterior posture, where the weight of the uterus is kind of carried posterior to the normal center of gravity. Like, essentially what I'm saying is low back pain, hip and pelvic discomfort is really a common complaint. And let's face it, it's just going to be increasing throughout your pregnancy as your baby's growing. It limits your daily activities. It can alter your sleep patterns. For some women, I see it almost like impairs a little mobility and can just generally decrease your quality of life. Oh, and there's relaxin, a hormone, and you guessed it, it's exactly what it sounds like. It relaxes things. It increases laxity in your ligaments, tendons, and fascia throughout that entire body, and can lead to all kinds of mischief. So when your hip joints are open, we call them abductors, hamstrings, your calf muscles are supple, and when your posterior muscles are really resilient, you are just going to be really better prepared for birth and labor. Regular therapeutic massage can not only help reduce stress, anxiety, but it addresses physical needs, and it can improve labor outcomes and newborn health. I've been a massage therapist now, specializing in prenatal, postpartum, and infant bodywork since 1999. So I now have over 20 years experience working with prenatal patients. And there's precautions, there's cautions, there's contraindications, even with healthy pregnancies. So I think it's absolutely necessary to have a working knowledge of high-risk conditions. And when I work with a woman who's pregnant, I'm always aware that I'm essentially working with two people simultaneously. And I think prenatal massage offers so many benefits for both that mom and the baby throughout the pregnancy. Massage touches every level of experience. It improves your mood, better sleep, less back pain among expectant moms who receive massage regularly. Massage can help you feel integrated, deeply sensing, relaxed, connected with you and your baby. That connection is so important. It really provides the ability to trust a deep source of intuition. Bodywork can also open a mom up to a wider kind of consciousness and experience, that of being comfortable with your growing and changing body and sensing the proximity and interconnected with that life that's growing inside of you. On a psychological and emotional level, touch therapy during pregnancy really helps women increase awareness of their bodies and deepen that connection to the human phenomena. I think all touch has an impact on your well-being. A closer and more positive relationship with your body and yourself, massage is really going to prepare you physically, mentally, emotionally for labor, and ultimately for motherhood. New moms who do self-care will likely find themselves taking better care of their babies too. I love to promote self and partner massages for client homework or self-care by just showing safe and effective ways to experience touch. Many women feel finding the time and tools for self-care really challenging through their lives. Let's face it, we're pretty busy. I really work to share, a few just simple and really doable stress management and wellness suggestions that really work. As you know, there's patients just have a few minutes and they want something really easy, like prenatal massage techniques you can do yourself. A massage is easily incorporated into your daily routine. Self-massage can help ease stress, promote relaxation, and enrich your perception of pregnancy, and it helps create kind of positive associations with everything in your surrounding environment. But I think the most important thing to remember is just with self-massage, keep your pressure light. You really don't need deep pressure. An important way to care for your own personal needs is something that we do every day, like a warm bath or a shower. That's the time that you have all by yourself, and you can self-massage along with this slow, relaxed breathing for a few minutes before your bath, and that'll really help you connect with your baby. Just get a body washing or exfoliating sponge, like one with a handle, so you can get to those hard-to-reach places. And you can just massage your legs and back after a long day of work and standing on your feet. Those circular strokes help improve circulation. And, we have long periods of standing or sitting. Some women are still wearing heels or shoes that are work shoes. We have poor seated back support. Maybe we're driving a lot. It can create all kinds of additional strain on your joints and legs and feet. So trust me, if you just even do something as simple as your feet and legs in the shower, your legs are going to thank you. Maybe you're all dried off or you're just hanging out in the evening. Just grab some lotion. One thing I always recommend is that it's all natural, organic products. I think shea butter and coconut oil are safe, and they're really good for sensitive pregnant skin. Massage can start to become a really daily ritual for you and your baby. Getting that massage allows you just to kind of release all that tension or pain that's limiting you from well-being. All day long, we're doing things like we're texting, we're going online, we're driving. We're really using our hands all day. And honestly, just something as simple as massaging our hands and forearms and elbows can just be amazing. Just try a gentle but comfortable pressure and work each area. in a few times it'll be easy to remember, to apply, to kind of get that in a, like to integrate it. It's always like about awareness, right? And sensing. I also, really think it's about kind of gratitude too. It's really all about a kind of connection. And the more you start touching yourself, the more you experience touch, the more you are aware of your posture, your breathing, your movement. I really think like the thing that separates an integrative massage therapist is really, it's important to recognize the wholeness of everything. True body awareness is kind of brought to you by the gift of touch, massage. And that wholeness, I think, really impacts every aspect of your daily life. As a new mom, pregnant, your body going through all those changes, touch allows us to kind of experience body awareness in our new bodies. It can actually be amazing because you know what? It can be like a chance to kind of melt away those old routines and physical patterns that you might have been trapped in before with physical discomfort or pain. And pregnancy massage not only connects you, your mom, as a mom, yourself to your baby, but it's actually cool. It's a really unique opportunity to kind of see yourself and body in a whole new way. I really like to put the emphasis on magic and the potential of things like morning exercise, morning meditation. Get up, greet the day, like get some fresh air, some sunshine, good old vitamin D. Just get it going. And as a massage therapist, honestly, I know the way you walk, how long you're sitting, how you sleep, how heavy things you're carrying, like diaper bags and all these things. They really impact your body, and they can cause like neck strain, back pain, that low back, hip, pelvic pain. So I think safe, effective movement really informs, it enhances, it reinforces the effectiveness that you're going to get from massage and body work. So just get out there, like move your body. You want to talk with your physician to make sure they suggest safe exercises and stressing, but at the end of the day, moving is a great way to feel better. Prenatal swimming routines. I personally took this thing called Tsunami Mommies, and that was like my personal favorite when I was pregnant. Prenatal yoga, it helps you let go of stress and worries. With yoga and massage and body work, it's really all about like breathing. Breath is so important. I always emphasize that. Sensing, getting aware of how your body feels with the breath. That's something you can do for self-care so easy. See how your body responds to air and is moved by just that simple act. There's a real awareness that occurs when we are gifted with those moments to just be still. We live in a culture where, and I'm totally one of these people where we're doing, and many moms feel rushed getting everything ready for the birth and for the baby. Sometimes I think you're so busy, it feels like you barely have time to notice that you're pregnant. And, it's so crucial to take the time for sensing, before we get busy with all those daily activities and rushing, just to be pregnant. What if we went completely offline? Don't be afraid to put your phone down for like an hour. What about a whole day? Wow. Meditation and mindfulness practices really help keep us grounded. And so if you just take a few minutes every morning and every evening and you just kind of open your heart to like that mystery of the growing life inside your womb. And you can add some tools too. Aromatherapy, it kind of provides a lot of benefits to your whole pregnancy during your labor and birth, as well as into the postnatal time where you and your baby are together. Essentially, essential oils are distilled from aromatic plants, so they're all natural. And they can be applied in a lot of different ways, and I think they're pretty simple and pleasant to use.